Opportunity for everybody to come together and try different things that they've never been able to do before.
What I've learned here is different skills that I thought I would never even be interested in learning.
By being here at Rogers, I can learn all these different things that will help me be stronger.
Working here as a volunteer is a good way to get to know your community. It's a good way to learn how to work as a part of a team.
They're people from our community, so they know and they have a heart for our community to step outside of our comfort zone and do more.
Don't be afraid, because this is where you're going to gain the most valuable experience that you can use in your future.
I encourage everybody to be a volunteer at Rogers TV because not only do you grow professionally, you grow personally as well.
This is Rogers TV, New Brunswick.
If you only knew what I'm going through, I just can't smile without you.
This is Rogers TV, Fredericton.
Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont le médecin hygiéniste en chef, le Dr. Jennifer Russell, et le Premier ministre, l'Honorable Blaine Higgs. Speaking on behalf of the province today are the province's Chief Medical Officer of Health, Dr. Jennifer Russell, and the Premier, the Honorable Blaine Higgs. Dr. Russell.
Happy Monday. Bonjour. Each day we learn more about COVID-19, and we are learning about how the virus is spread, who it is most likely to harm, and how we are alerted to its presence in our human body. So we're applying these lessons as quickly as we can to give ourselves the best chance of slowing the progress of the virus so that it does not overwhelm our healthcare system. In recent weeks, we know that the symptoms for COVID-19 are broader, and so we would like to announce today that we're changing our testing protocols to capture the broader range of symptoms. So we're now asking that New Brunswickers monitor themselves and their families for the following symptoms: a fever of 38 degrees Celsius, a new cough or worsening chronic cough, a sore throat, runny nose, and headache. And if you have 2 or more of these symptoms, please self-isolate immediately and contact 811 or your family physician for further instructions, and then follow those instructions very explicitly. Pour cette raison, j'annonce aujourd'hui un autre changement dans nos protocoles de dépistage afin d'inclure un plus vaste éventail de symptômes. Nous demandons aux Néo-Brunswickoises et aux Néo-Brunswickois de vérifier si leur famille ou eux-mêmes ressentent les symptômes suivants: la fièvre dépassant 38 Celsius, nouvelle toux ou toux chronique qui s'aggrave, mal de gorge, écoulement nasal et mal de tête. Si vous ressentez 2 de ces symptômes ou plus, veuillez vous auto-isoler et appeler le 811 ou votre médecin de famille pour obtenir des directives supplémentaires et suivez-les à la lettre. The symptoms I have listed will seem relatively mild and not uncommon. So particularly when we're coming to the end of the winter cold season and the start of spring allergies. But this virus has the potential to cause mild, moderate, and severe illness, and therefore it's important to take precautions even with mild symptoms like a runny nose and headache. Again, this change will likely result in increased demand for testing, but I'm confident that our laboratory has the capacity to address this. So today there are 2 new confirmed cases of COVID-19 in New Brunswick, and this brings our total to date to 116. The new cases are as follows: an individual aged 40 to 49 in Zone 3, which is the Fredericton region, an individual aged 50 to 59 in Zone 5, the Campbellton region. Pour cette raison, j'annonce aujourd'hui un autre changement dans nos protocoles de dépistage afin d'inclure un plus vaste éventail de symptômes. Nous demandons aux Néo-Brunswickoises et Néo-Brunswickois de vérifier si leur famille... Oh, j'ai déjà lu ça. Je m'excuse. Alors, our COVID-19 caseload remains relatively low in comparison with neighboring jurisdictions, but we are still a long way from winning this battle. Now more than ever, it is vital that we do our part by staying at home to the greatest extent possible. It's important that you continue to practice physical distancing when you go out and keep your interactions with others brief. Please keep washing your hands regularly and thoroughly. We can't give this virus any chance to get a firmer hold in New Brunswick, and that is why we are announcing this change in our testing protocols. Il est essentiel de continuer à pratiquer la distanciation physique lorsque vous sortez et que vos interactions avec les autres soient brèves. S'il vous plaît, continuez à vous laver les mains fréquemment et soigneusement. Nous ne pouvons pas donner à ce virus la possibilité de se répandre davantage au Nouveau-Brunswick. C'est pour cette raison que nous annonçons ce changement dans nos protocoles de dépistage. Please keep in mind that this disease is new to all of us, including medical science. It is only 4 months since COVID-19 was first detected in humans, and every day we are learning more about its characteristics. The symptoms that were first reported, fever and cough, are still the most common indicators in terms of the percentage. So we do know that there are many different symptoms, and they represent different percentages in terms of the majority of symptoms that we see the most commonly. So we want to make sure that we know about every case, and that means adding new symptoms that are appearing in the rapidly evolving medical literature. So, and if you are advised to self-isolate, this means you must not leave your home. Si vous ressentez 2 de 5 symptômes, cela ne signifie pas nécessairement que vous êtes atteint de la COVID-19. Mais en vous isolant rapidement, vous réduisez la chance que votre famille, vos voisins et votre communauté contractent la maladie si vous êtes en attente. Si vous recevez la consigne de vous isoler, vous ne devez pas quitter votre domicile. Ask a friend or family member to pick up your groceries, medications, and other supplies. Until you are sure that you are not infected, avoid contact with others. Continue to prioritize testing for those most vulnerable to the disease, including persons over the age of 60, those with chronic conditions such as heart disease, lung disease, diabetes, or cancer, and residents of nursing homes and special care homes. We must look after those who are looking after us. A dedicated phone line remains in place for healthcare workers to report symptoms and seek direction. Please be assured that if you have been tested, you will be contacted by public health with the result of your test. I am aware of the stress and anxiety this pandemic is creating for New Brunswickers, and remember that you are not alone and help is available when you feel overwhelmed. You can always contact your primary care provider, your local addictions and mental health services. You can visit the Canadian Mental Health Association of New Brunswick at cmhanb.ca for available services. For children and youth, you can call Kids Help Phone or text CONNECT to 686868. Tu as besoin d'aide tout de suite? Texte parler au 686868. I am asking that everyone continue to show courage, even when you may not feel particularly courageous. We have shown tremendous heart and resilience so far, and I commend everyone for the efforts you are making. We will get through this, but it will take time. Nous avons fait preuve de beaucoup de cœur et de résilience jusqu'à présent, et je tiens à tous vous féliciter pour vos efforts. Nous allons surmonter cette crise, mais cela prendra du temps. Thank you very much.
Good afternoon. Bonjour. I hope everyone was able to have a nice Easter weekend, even under these extraordinary circumstances. I know for most of us it was a very different Easter. Instead of visiting in person, I reached out by phone to wish my mother a happy Easter, and I'm sure many of you did the same thing with your family and with your friends. J'espère que vous allez être nombreux à souhaiter des joyeuses Pâques à vos proches, mais en gardant vos distances. Alors que nous poursuivons notre lutte contre cette pandémie, il est très important de continuer à rester en contact avec les aînés qui font partie de nos vies. I encourage everyone to reach out to their elderly loved ones over the phone, through video calls, or by email and text. Caring for our seniors is always of the utmost importance for our government, and it has been one of our key priorities since the start of this pandemic. That is why we took early steps to protect residents living in nursing homes. We have continued to take additional steps as more information has become available. We stopped allowing visitors to nursing homes very early on. We've accelerated nursing home placements from hospitals, which means 157 seniors who were receiving alternate levels of care have now been moved from hospitals to nursing homes or long-term care homes. Nous avons mis en place des processus avancés de contrôle pour les employés avant qu'ils puissent entrer en travail. Par exemple, tout le monde doit prendre sa température et répondre à plusieurs questions de contrôle. Nous sommes en communication constante avec l'Association des foyers de soins de New Brunswick depuis le début de la pandémie. We continue to focus on communication to do our best to ensure staff are kept well informed as new policies are implemented. On-site physicians and clinical staff have been instructed to care for residents whenever possible to avoid any unnecessary transfers to hospitals. Training is ongoing for nursing home staff members on the proper use of personal protective equipment, and all direct patient staff are now required to use this equipment. We have also put operational plans in place. Any seniors displaying respiratory symptoms of any kind will be isolated immediately, and we are treating all symptoms as though they are COVID-19. We are continuing to monitor the situation in our nursing homes, and we will take additional measures if needed as the pandemic continues. I wish to thank the staff and management of the many nursing homes throughout our province who have shown their dedication, their perseverance, and their will to do what's right for the residents and for the people of this province. Today and over the weekend, we saw only a few new cases of COVID-19. 74 of our 116 confirmed cases have now recovered from the virus, which means more people have recovered in New Brunswick than are currently confirmed to be ill. That's good news, but it is not the time for us to relax. As Dr. Russell just pointed out, we are expanding our testing at their recommendation to ensure that we understand completely what is happening in our communities and in our facilities. We must continue to obey public health's physical distancing guidelines. Nous devrons continuer à respecter l'ordonnance d'urgence qui est présentement en place dans la province. Nous sommes sur la bonne voie pour sortir de la pandémie en bien meilleur état que d'autres endroits. I want to remind you, however, that there have been more than a dozen new cases in the last week, and there are still 3 New Brunswickers in serious condition receiving treatment in the ICU. These numbers will likely continue to increase in the days and weeks ahead. J'espère que vous aurez tous des bonnes pensées pour ces personnes et leurs familles. Maintenant, plus que jamais, nous devrons garder la cap. Nous devrons tout continuer à faire tout ce que nous pouvons pour garder le nombre de cas le plus bas possible. So far, the vast majority of people have been respecting the rules imposed under the Emergency Measures Act to slow the spread of COVID-19. We need to keep it up. Together, we have the power to minimize the loss of life to this terrible disease. Law enforcement agencies are receiving hundreds of calls weekly from people concerned about violations, and they are responding. Most of these violations are able to be resolved by educating the people involved. Of course, a small number of people are still violating the rules and behaving inappropriately. 17 tickets have been issued in the last 7 days. 26 tickets have been issued in total since the emergency order went into effect. Ces amendes sont un mesure d'un dernier recours. Notre objectif est d'assurer le respect de la loi et non de punir les gens. J'espère que personne d'autre ne va se mettre dans une situation où des agents devront donner une contravention. Right now, there are no vaccines for COVID-19, but many experts are working to find ways to treat people who have this illness. Organizations like Canadian Blood Services, for example, are working on potential treatments using plasma from people who have recovered from the virus. New Brunswickers are known for their willingness to help out in times of need, and I know this situation is no different. Any clinical trials are launched in the coming weeks. As clinical trials are launched in the coming weeks, potential donors may be contacted by Canadian Blood Services. I would encourage you to help them out if you are able. The predictions we shared with you last week, that it is possible for New Brunswickers not only to flatten the curve, but to exceed best-case predictions. We are on the right track. Je vous demande de continuer à rester à la maison. Lavez vos mains. Gardez une distance d'au moins 2 mètres avec les autres personnes quand vous devez quitter la maison. In the weeks ahead, we will be able to determine the outcome of this long weekend. We will know if the current restrictions have been complied with and if they have been effective. This information could possibly allow us to change our level of restrictions in the weeks ahead. But for now, we have to continue to do our part. Thank you. Merci.
Thank you, Premier. Merci, Monsieur Premier Ministre. Thank you, Dr. Russell. Merci, Dr. Russell. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue de votre choix. Chaque journaliste aura une question. We will now proceed with questions from the media. You have the right to pose your question in the language of your choice, and each reporter will have one question. Vicky Hogarth, Charlotte County TV.
Thanks, Bruce. My question is for the Premier. I was speaking with PSWs in long-term seniors care facilities this weekend who told me that Horizon and Shannex have decided to give personnel 2 surgical masks per staff member per shift, so that these masks are supposed to be put in plastic bags while they're on break, which they believe isn't sanitary. Also, surgical masks don't do anything to protect the caretakers from infection, and their stance is that you wouldn't put a firefighter in a building without protective gear, but they're being asked to put themselves and their families at risk every day. So how can we do better?
Well, I think certainly I'll leave that. The real answer to that should be from the health professionals. This has come from a recommendation that would be better protection. I think it's not necessarily necessary, but it wouldn't be my decision whether the N95 mask would be available or needed in each and every case. I think that we have to manage the supplies, but we have to do in a way that protects our workers. So certainly the question would come back to the health authorities, and Dr. Russell may want to talk on that further. But for me, I will ask the health authorities to respond to any questions or concerns that come back from employees, and it's directed with a response that is, can be categorized as best practice. Sure.
So my understanding is the intent of that directive was around protecting patients from potentially being infected by healthcare workers. So the secretions that could come out of a patient's, of a healthcare worker's nose and mouth would be contained within the surgical mask. And so thereby, if they were very, very mildly symptomatic or pre-symptomatic or asymptomatic, then the risk of transmitting COVID-19 to a patient would be lessened. And so it wasn't really about protecting the healthcare workers, it was about protecting the patients from potentially being infected. As we know in other jurisdictions, when nursing homes had outbreaks, usually it was somebody that brought the infection into the facility. So this is a mechanism to protect the patients.
Thank you. Vicky, would you have a follow-up question?
I do, Bruce. Thank you. It's also for the Premier. As we know, many businesses such as cannabis producers, dentists, labs, construction companies have stockpiles of PPEs. Donation drives for medical grade protective equipment are happening in other provinces to help distribute them to frontline workers. Has the Pandemic Task Force created a website for New Brunswick to centralize donations of equipment and other critical items like hand sanitizer?
I would say yes to that, because we are very cognizant of different companies that are now producing sanitizer, looking at protective suits to wear, and I don't have the number, but I know there is a list of companies that have offered for supplies, and we can certainly provide that to you, because I've seen the list. But I don't know what the contact number is for that, but Service New Brunswick have been putting that together throughout this last several weeks.
Thank you. Margot Castellac-Cobari, Radio-Canada.
Oui, bonjour, ma question sera posée en français. Comment est-ce que la province se prépare pour affronter les inondations printanières dans un tel contexte de pandémie et pour aussi éviter bien sûr la propagation de la COVID-19 au Nouveau-Brunswick?
Thank you for the question. Although it's still right in the start of the season. I spoke to the EMO coordinator this morning, discussing the current weather conditions, the state of our river system throughout the province, and also what the risks were. We do have a rainfall coming tonight, but it's not to be excessive. I think it's 20-30 millimeters, so it's significant, but not excessive. Ice conditions are not severe at all at this stage, and the current projections are that we won't be seeing anything at all like we've saw in the last couple of years. So we are watching this very closely, and as the river rises, certainly EMO have been involved, our emergency measures organization, from the early days of the health pandemic, and they have put measures in place so they can operate and respond to flooding conditions. and follow the health concerns that we've put in place throughout the province. So I'm feeling very positive on two fronts. One, that we're ready to respond if needed, but secondly, the current projections are that it will be a normal season in terms of water levels, unless we get a very severe rainfall that is currently not predicted.
As-tu un suivi, Margot?
Non, merci, ce sera tout.
Merci. Adam Harris, Telegraph Journal.
Hi there. Thousands of temporary foreign workers will soon be destined for New Brunswick. Is there any concern about them bringing the virus into the province, and are there any provincial measures planned, like mandatory testing, to stop that?
So I will start with that question and answer that in the sense of what I know about it. We've had extensive discussions from my provincial colleagues and the federal, the Prime Minister and the Deputy Prime Minister about the need of the temporary foreign workers. So there've been several type of scenarios proposed. I mean, some in the sense that they would come and have a central isolating location here for the 14 days. They certainly will not be allowed to go right directly to work. There'd be no situation where that would apply. But also the discussion around, with kind of record levels of unemployment in all of our provinces as a result of this pandemic, can we look at the need to lessen our dependence on temporary foreign workers and utilize many of the people that today could be at home looking for work? And that's been a basis for discussion, and I spoke to the Deputy Prime Minister just on the weekend about this very thing, and last Thursday evening, I think it was Thursday evening or Wednesday evening, across the country about this very thing. So we are looking, working with PEDAL, working with social assistance, working with the federal government on the EI to see if we can balance some of the requirements with the employees that we already have here in our province.
Thank you. Adam, do you have a follow-up question?
Yes, please. The federal government has released long-term care guidelines, but they're just that, they're guidelines. Are there any plans for mandatory measures for the province's care homes? I know, Premier, you just talked about potential additional measures if needed. What would those be?
So you're talking about the Public Health Agency of Canada's long-term care facility guidelines, and those were just released in the last week. New Brunswick had its own long-term care facility guidelines, which had already been distributed to the different nursing homes, etc. And so we took our New Brunswick document, took the Public Health Agency of Canada document, and updated ours. And so that's going to be redistributed to our partners. And it was actually discussed at the task force in terms of all the different pieces that go along with that. So the information around personal protective equipment, what type of training needs to happen. So those conversations are happening along with social development, along with our partners at the RHAs, and along with the working group that's working on vulnerable populations within the Health Emergency Operations Center. So all of those conversations are happening around how to operationalize whatever new information is in there, and we have great collaboration with all of those partners, including the clinical leads in Vitalité and Horizon.
Thank you. Matthew Wacomo, l'Acadie Nouvelle.
Bonjour, il y a beaucoup question aujourd'hui d'un nouveau test qui a été approuvé par Santé Canada. On appelle ça le Cube Spartan Cube. C'est un test portatif qui permettrait d'analyser des échantillons de façon beaucoup plus rapide et sur place, sans avoir besoin d'envoyer tout ça dans un laboratoire. Je sais que certaines provinces en ont déjà commandé. Est-ce que c'est possible que ce test-là soit utilisé au Nouveau-Brunswick sous peu?
Alors, n'importe quel test qu'on discute, c'est toujours en discussion avec l'Agence de santé publique du Canada et aussi Santé Canada. Alors, ces discussions ont eu déjà pour les nouvelles types de tests qui sont disponibles maintenant. Alors, celui qu'on vient juste de commander, c'est celui du GenX. Alors, ça, c'est quelque chose qu'on a déjà déployé aux différents hôpitaux dans le système. Et pour celui que vous décrivez maintenant, on est en train d'avoir des discussions avec la compagnie elle-même. Alors, n'importe quel type de test, c'est des conversations qu'il faut avoir avec la province et aussi avec le niveau fédéral. Et aussi pour évaluer comment important que c'est à tel temps dans la pandémie pour utiliser des tests comme cela. Alors, on sait que même quand on commande des produits, des fois, ça prend du temps pour les recevoir et les implémenter. Alors, ça, c'est des choses qu'on prend compte dans nos discussions aussi, mais on a déjà parlé à cette compagnie-là.
Merci. Monsieur Como, as-tu un suivi?
Oui, merci beaucoup pour la réponse. Vous avez parlé d'un autre test, le test Genex. Je pense qu'on en avait déjà parlé, mais pouvez-vous nous rappeler c'est quoi exactement et puis qu'est-ce que ça a changé dans la façon de faire au Brunswick?
Alors, les tests, ceux qui ne sont pas le Genex, qu'on utilise maintenant, qui vont à le laboratoire à le Georges Dumont, l'hôpital Georges Dumont à Moncton, ces tests-là, ça prend environ 24 à 48 heures pour recevoir le résultat. Celui de Genex, c'est bien plus rapide. Alors, mais le processus, comme ceux qui prennent 24 à 24 heures, on peut faire 1000 tests par jour. Avec le Genex, c'est moins, mais c'est plus rapide. Alors, c'est quelque chose qui est vraiment important dans les situations qu'on aimerait dans l'hôpital d'avoir un test vraiment rapide, comme quelqu'un qui accouche, quelqu'un qui va avoir du chirurgie, des situations comme ça. Alors, c'est vraiment des situations spécifiques dans l'hôpital qui demandent quelque chose de plus rapide. Alors, ça, c'est la manière qu'on va le déployer maintenant.
Merci. Gail Harding, CBC.
This question is for Premier Higgs. The province's emergency declaration is expected to last another week. Will it be extended, and if so, for how long?
It is likely that it will be extended. It'll be done in 2-week increments. It'll be a decision that's made collectively with my COVID committee colleagues, the leaders of the other parties, and my cabinet. But it'll be done in 2-week intervals upon any extension.
Thank you. Gail, do you have a follow-up question?
Yes, one for Dr. Russell. With the expanded testing, what was the concern that led to this expansion in the testing? Is there a worry that there are people out there that are not being reached through the previous way of doing the testing?
So there's a couple of pieces to that question in terms of how our testing criteria have evolved. And our testing criteria have evolved based on the changes in risk. So originally it was around travel outside of Canada, then it was travel outside of New Brunswick, then it was higher risk populations, so people who worked in healthcare settings, people who had comorbid conditions over a certain age. And so, and people would ask, well, what is the community transmission like right now? What are your concerns about community transmission? Because we know that the shift in other provinces and other jurisdictions has always been, you first see the travel-related cases and the clusters around that, and then it shifts to becoming more, the majority of cases are community transmission. We haven't really seen a big uptick in community transmission, and people say, well, maybe you are missing people, but our indicators around the percentage of the population that would be affected most severely, we would see those people pop up in the hospital setting, and we only have a small number of people hospitalized and in ICU right now. So we know that in other jurisdictions that severely affected percentage usually is a reflection of the total number of cases in the population. So at this point in time, expanding it will allow us to make sure that we're not missing anybody, although all the sentinel testing that we have done thus far in emergency departments and as well as hospital settings, that sentinel testing, all of those tests have come back negative. So I think at this point in time, knowing that we are spreading the net quite wide, provide. It could give us more information. Do we expect to see more community transmission as a result of increased testing? It's hard to say at this point. We're trying to be cautiously optimistic, but we don't want to rest on our laurels. So I think we're being prudent with the information that we know today and with the resources that we have, that this is the right direction to go in according to the evolution of the risk.
Thank you. Silas Brown, Global.
Hi, Premier. Both you and Dr. Russell have said on Thursday that this could really prove to be a make or break weekend for the province as we move through this pandemic situation. I'm curious if you could speak a little bit about enforcement and how things went. I know you gave a number of tickets over the last week, but when officers were out there, were they identifying people who were skirting the instructions, or for the most part were New Brunswickers fairly well behaved and did what you and Dr. Russell had asked?
Silas, I believe that overall that the people in New Brunswick have followed very closely the compliance requirements and have worked diligently to be part of the solution. There were some cases that I identified, and while I'm more interested in the educational part of it and the ability to change people's behavior than I am simply slapping them with a ticket, because that's not the goal, is to find people more, but the goal is to have people adhere to the rules that are now in place. And so I think to a large extent they have been followed. Now I do have some indication of cases where they weren't and people were out, but I don't get a list. I mentioned in my notes about there were a number of calls that were made, concerned citizens. So it's great when we all look out for each other, and I think we've seen that. So over the coming weeks, because it'll take now a week, 2 weeks for us to see if this weekend, if compliance issues were really followed and people did isolate and they did keep their distances, we'll know over the next few weeks. So by the end of April, we'll know just how successful this weekend was.
Thank you. Silas, do you have a follow-up question?
Yeah, you also spoke about the possibility that as we move through the next couple of weeks and we look at how things have gone, that we could see possibly some restrictions being eased. What would it take, I guess? What do you and public health need to see in order to start pulling back some restrictions, and what would be the restrictions that would begin being eased likely at first?
Well, I think the specific words I used were some restrictions could change. Now that could be up or down depending on the level of adherence we see and the testing that now Dr. Russell has placed, what it shows. So am I looking for a positive change? Am I hoping for a positive change? Absolutely. And do I feel that if our numbers stay the way they are and if our caseload stays down and we're able to identify different areas, do we need to start our economy back up? Do we need to get people being able to move about while respecting many of the rules that are in place, because we will have to for some time? Yes, I do. I think that's important that we start to reach a norm, but that new norm is going to be different than the old norm. Getting our economy back up and running, it's all about a balance, and that's what we're in right now. So I'll remain optimistic, certainly as long as our numbers are where they are, and if they continue, not to increase, and we can be sure of areas by having a good, clear understanding of communities and in any community type of contamination. But I'm an optimistic person by nature, so I'll always look for a continuous improvement.
Thank you. Laura Brown, CTV.
Hi, Premier. I'm wondering if you can elaborate a little bit more. I hate to ask, but if there's any timeline in your head that you can give us on when you can foresee, if we are able to see these numbers down day after day, you could foresee towards the end of April or late May, some of these restrictions being lifted. And by that I mean potentially certain businesses like restaurants being being able to open back up maybe at a 50% capacity?
I think it's very difficult to put a date on it. I think it would be a somewhat of a shot in the dark if I did that. I mean, would I like to see us, be able to ramp up? Well, firstly, we get this the spring freshet behind us. That'll be nice, and we will know that by the end of this month. Certainly, if our numbers stay down and we have a good community understanding, we'll know that by the end of this month. If we extend the Emergency Measures Act, as I said, it would go for another 2 weeks, and that'll be depending on the conditions that we see at the time of making that decision. I believe that, we will be able to make some changes towards the end of May, but I think it's very, very difficult to put a date on it. I'll be working closely with public health and officials across the province, understanding, where can we move a little bit, how can we contain anything within a different region of the province, because we have pockets throughout our province, and we don't want to spread those pockets. And we haven't put a province-wide ban on traveling, but we basically said people need to stay home. Will we be able to relax that some by the end of the month? Let's hope so. But it's very much an unknown, Laura, and I think it would be unwise to put a date on it.
Thank you.
We've seen that happen in the U.S. a few times. Dates being placed on things, and they actually didn't come to pass, did they?
Laura, do you have a follow-up?
Super quick, yes. And I know this is probably another unfair one, Premier, but 2 weeks ago you said about over $20 million has already been spent in that one-time $900 benefit. At this point, how much do you think, or do you have estimates in your head as to how much this has cost the province so far?
Well, we have had 67,000 applications. So, they're all in their assessment process at this point in time. At this stage, we will have I spent out probably in the order of 30 million, but I don't know the exact number, but 67,000 have applied. So, but they all won't qualify, but it'll be the process they'll follow, but I don't know how many at this stage.
Merci tout le monde. Voilà la fin de notre mise à jour. Merci. Thank you all. That concludes today's update. Thank you.
Length of the preceding program, we now join the regularly scheduled program already in progress.